Hi, we're here with Dr. Steve Arshinoff from Canada, who would enlighten us about bilateral cataract surgery. So, Dr. Steve, what is bilateral cataract surgery?
Well, bilateral cataract surgery technically refers to having both of your eyes done at any time. But the general concept is that people accept is it means you're having both of your eyes done at the same time, not the same time, but the same day, so one after the other. Patients like it because it means that you have it done once and you get up and you can see and you have to come back so often. It's easier, but they're afraid if there's any particular risk in having bilateral cataract surgery. And in reality, the risk of each operation is the risk of each operation itself. And if you do two operations, the risk is no different if you have them done sequentially the same day or sequentially a week or two apart. It's the same risk as the same operation. Those of us who do bilateral cataract surgery make a big effort to keep everything completely sterile so that the eyes are done as if it's two different people. Everything is changed from the first to the second eye, so the risk is not higher in any individual than doing two eyes of two different people. Cataract surgery in general is the safest operation you can do. Doesn't mean there's no risk. So every operation in the world has risk. You can drive your car and somebody can hit you. You can get a drug injected into your arm and you would have a reaction and die in 10 minutes or 5 minutes. There are all kinds of unusual risks that can happen in life. In surgery, you can have an infection, you can have an hemorrhage, you can have lots of things. The surgeon's job is to try to do whatever he can to make sure those things don't happen. Doesn't mean they never happen, it means they very rarely happen. So you have to look at surgery not from the point of view, is there risk in me doing it, but am I better off having the surgery or am I better off not having the surgery? And generally speaking, with cataracts, if you leave them, well, they get worse and worse until you can't see at all. So you're definitely worse off not having it done. In bilateral cataract surgery, are you better off having both eyes done the same day so you can sit up and resume your normal life in one day, or having them done a month apart or 2 months apart or whatever? Whenever you do them separately, you are somewhat incapacitated in that intervening time because you can't see with two eyes together. They function differently. So many patients really like having their eyes done together, and most places that give patients a complete free choice of what they want find out that after a short time, about 80% of patients prefer to have both of their eyes done the same day.